You've complained to me in the past about soreness along this side of your wrist, right along here. So this is the radial side of your wrist. You could have some wrist arthritis as well. Sometimes people have a ganglion cyst right over here, but I don't see any swelling. And then sometimes people just have tendonitis. So typically if it was tendonitis, they would say, I'm really sore right here. I can't lift a pot off the stove when my hand is pulled down like this and I'm trying to lift upwards. It hurts so bad right there. If it were thumb arthritis, you would just say forceful pinching and grasping was sore and it just hurts kind of at the base of the thumb. But from what I recall, your complaints were, it hurts to move my wrist down and it hurts to lift upwards like holding a pot. Pain at the base of the thumb is typically a pinching and grasping pain right here. It hurts with forceful pinching and grasping. But the tendonitis pain that I think is your problem typically occurs right here. And when your wrist is down or your thumb is down and you're trying to lift a pot off the stove, that's when it hurts right here. One of the best ways to check for that tendonitis pain is to have you recreate that position. We're going to put your thumb down, we're going to wrap your fingers around it. Now I'm going to hold your wrist and we're going to move it down. Now, are you sore right along here? Mm-hmm. That's the spot? Right. So that's pretty classic for tendonitis, and this area is called the first dorsal extensor compartment. The fancy name for this disease is called Dequervain's tenosynovitis. It's just a fancy name. It just means tendonitis, and it's really treatable. It's pretty easy to treat. Probably 65% of the time we can get it to go away with a couple of steroid shots, maybe a brace, maybe some anti-inflammatory medication like Advil or Aleve. Typically we would start by injecting the first dorsal extensor compartment, putting your thumb in an immobilizing brace so that the thumb itself doesn't move for about a week, giving it a chance to rest, and if we're lucky, it goes away. If it doesn't, there is good surgery. It's pretty easy to do. That's very, very effective. Now, you might just be wondering, what is it? So tendonitis is ultimately a size mismatch problem. There are two tendons going through what we call the first dorsal extensor compartment. It's really just a tunnel. So we have two ropes trying to fit through a tunnel, and these tendons, these ropes, are too big. They're swollen, and the tunnel's too small, and they're getting stuck, but that creates pain. It hurts. And unless you give it a chance to rest or treat it with a steroid shot, it's probably not going to go away. But conservative treatment really actually works quite well.